Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is what you need to know about facet joint syndrome. There are facet joints at every level of the spine, all the way from the neck down to the sacrum. There are ones on the right and the left. Each one's about the size of a thumbnail, and they do have cartilage just like other joints, the hip or the knee. Together they allow an impressive range of motion for our spines to bend, flex, extend, rotate. It's amazing. Now, even though the joints are very small, they can be an impressive source of pain when they become arthritic. So facet joint arthritis starts in the disc, which is in the front, okay? The disc starts to degenerate, it becomes biomechanically incompetent, and the stresses shift to the back of the spine where these facet joints are, and they start to see much more stress and become arthritic. You can see bony overgrowth here, the redness denotes inflammation, and that can become very painful. So why is facet arthritis more complicated than hip or knee arthritis? We don't have an effective facet replacement like the hip or the knee. It's a very complicated joint. It's tiny, so we just don't have that right now. There are 2 facet joints at every spinal level, and usually multiple are affected. I mean, think about it. You have 2 knees and 2 hips. You have over 40 facet joints. And even though they're small, they can produce significant pain, or you may have significant arthritis but no pain at all. So why do people develop facet syndrome? Most commonly it's from good old degenerative wear and tear osteoarthritis. It could be post-traumatic. For instance, when you have whiplash, such as seen here, that can cause significant trauma to your facet joints of your neck and lead to post-traumatic degeneration. And there's also a large amount that we don't understand. How's the problem diagnosed? Well, history and physical are helpful. X-rays can be highly suggestive. Patients may be asymptomatic at a level that shows severe arthritis. So interventional procedures can be both diagnostic and therapeutic. For instance, here's a medial branch block where numbing medicine is being put around the joint. If that helps, then you can reasonably say, aha, this is the level of arthritis that's causing the pain. Now, when you actually have the diagnosis of facet arthritis and pain, what are the treatments that are available? Well, medication management may include anti-inflammatories and Tylenol. Short-term opiates are okay for exacerbation periods. Long-term opiates are a bad idea for facet arthritis. And then prescription pain creams and patches, those can be very helpful as well. Physical therapy and chiropractic treatment can help. TENS units are about the size of an iPod. They have foam pads that go over the area of pain, and they can change the way the brain perceives pain signals. What you see here is spinal decompression therapy. It's intermittent computerized spinal traction that helps decompress those arthritic areas, and that can provide pain relief for 3 to 6 months. When it comes to interventional treatments, what you have are some great options. This is a picture of the joint, okay? You can see that there's little nerve endings providing sensation to the joint, and that's how they feel pain, okay? These are called the medial branches. So a medial branch block involves placing numbing medicine, possibly some steroid, around the joint to stop the sensation from these little nerve endings, okay? That's a great treatment. When you look at facet injections, what you have is the needle going right into the arthritic facet joint, just like you would for a hip or a knee, and numbing medicine and steroid being placed. That can also provide pain relief for weeks to months. And then if those work and then wear off, you can repeat them or undergo a radiofrequency ablation. This is where a catheter goes around the arthritic joint and thermally coagulates. Basically, it heats up and deadens these little nerve endings. And that can provide consistent pain relief for over a year, often 18 months. So how effective are these treatments? Medial branch block is 85% effective with average pain relief of 3 to 4 months. And like I said, it can either be repeated or you can move on to a radiofrequency ablation. The ablation procedures are 80% effective for 6 to 18 months, and you can repeat it. All in all, over 95% of patients are able to achieve a satisfactory non-operative outcome with facet syndrome. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified physicians. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.